Our first case study of domestic policy is looking at healthcare, specifically the development of the Affordable Care Act and looking at how President Obama balanced his desire to require insurance companies to provide insurance to people with pre-existing conditions and his need to actually get insurance companies on board and everyone to sort of agree to this plan. Because remember, policy is not made by just one individual. We need a lot of people on board to actually get things done. And because insurance companies would ultimately be providing our health insurance coverage, they had to be okay with this law. If not, it was never going to be successfully implemented. So, the way insurance generally works is that we buy our insurance privately, either subsidized by our employer or just on our own. If you're self-employed or gig worker, you probably buy it on your own. Now, that is true for the majority of Americans, but there are actually two single-payer systems in the US, Medicare and Medicaid. Medicare is a government program that insures the elderly and certain people with qualifying disabilities. And Medicaid insures people who earn under a certain level of income. So that one's means tested and helps poorer people afford insurance, whereas again, Medicare helps the elderly and the disabled have insurance. So these two are government programs where the government covers our health and insures our health coverage, basically. Now, again, the rest of us buy through private insurers. And if you are paying money for this, you might say, do I really want to? Right? You are probably young and healthy. And you think, I mean, yeah, sure, I could get sick, but what are the odds? Like, I'm I don't know, 18, 20, and come on, am I really going to get sick? So you're sitting there thinking to yourself, I could pay money in that I will probably never collect out, or I could just not pay the money. Why be insured? Well, maybe you want to be insured because something catastrophic could happen, right? You can be young and healthy and still get hit by a car or have your appendix burst. But you're like, no. If that happens, I go to an emergency room because, it's an emergency. And actually, emergency rooms that accept Medicare, which is virtually every emergency room in the US, have to treat patients regardless of their ability to pay. So I can just get care for some sort of catastrophic emergency if I need it. So basically, you're proposing that you will free ride on basically taxpayers who are funding these emergency rooms. Now, that's all fine and dandy, but insurance companies make money off people paying in who then don't collect benefits. So they make the most money off young, healthy people who might be opting to free ride. So when healthy people buy insurance, generally the insurers are going to make money because they're paying in premiums and not collecting a lot of benefits. But when sick people buy insurance, it's difficult for insurers to make a profit because they have to pay out sometimes more than people will pay in premiums. Now, that leads to a big problem. If healthy people free ride and insurance companies are trying to cover people who are ill, then insurance companies are going to have to raise premiums. And maybe the people who aren't really that sick are going to stop buying insurance because, wow, now the premiums are so expensive, they could just afford to go to the doctor without insurance. Like for the same price that they're paying for their insurance, they could have just gone to the doctor. So why pay for insurance? And ultimately, we end up in this death spiral, as it's called, where premiums just keep having to increase as more and more people drop out of having insurance. Now, this obviously is not a good model for insurers. No insurance company wants a death spiral. It means the death of the insurance company. So insurers have basically two ways around this. They can either get young, healthy people on to their insurance plans, so stop free riding, or they can stop covering really sick people. Because if you have someone who you're going to be paying a lot of money out for, then if you can deny them coverage, you don't have to worry about a death spiral because you don't have to raise the premiums to make money to cover paying for really expensive treatment. So people who've had cancer in the past are much more likely to have cancer again, at least for certain types of cancers. People who are asthmatic are going to have inhalers their whole life and are much more prone to respiratory illness. Diabetics have insulin, right? We have all these different illnesses that are chronic or potentially recurrent. And if you can deny people with those conditions insurance, then you're not going to end up in the death spiral, even if young, healthy people do still want to free ride. Because you're going to get that sort of risk averse, healthy people, and then maybe middle aged people who aren't really that sick, but think, well, I'm getting older, I might get sick. So you ultimately end up with a model that still is financially reasonable. The thing is when President Obama went to craft the Affordable Care Act, he said, we have to provide insurance for people with pre-existing conditions. This is an incredibly popular aspect of the Affordable Care Act. The vast majority of Americans support this. And Obama was adamant, this has to be there. But insurance companies are like, yeah, but then get us the free riders. Like, stop people from free riding, get us those so-called young invincibles, people who are most likely to free ride, and then we can talk about covering people with pre-existing conditions. So Obama, along with Congress, and input from these insurance companies, crafted these two provisions, went hand in hand to stop free riding and to encourage people to buy health insurance. The first was to lower the cost. So the carrot, the benefit, we offer taxpayer subsidized premiums to those whose companies don't offer health insurance. So if your employer doesn't subsidize it, the government will. And this is through those insurance markets where you can buy private insurance now in a marketplace rather than on your own. Now, that's not going to be enough. There's still going to be people who are like, I don't want to spend any money on this. So we have a stick, a punishment if you don't buy health insurance. You have to pay a tax penalty. Well, now you're paying money to not have insurance. You might as well just pay money to have insurance, right? At least at the end of the day, insurance you might not collect, but if you do, you're getting something out of it. Whereas a tax penalty, you're getting nothing out of that, right? So that created the individual mandate, this requirement that everyone pay a penalty if they did not get insurance. So this was necessary, these individual insurance markets and the individual mandate, in order to ensure that young, healthy people would stop free riding and that insurance companies would be able to cover people with pre-existing conditions without risking a death spiral. Now, this individual mandate idea was actually originally proposed by conservative groups. The idea here was this economic logic that we're preventing free riding. Free riding is just evidence of market failure. And we know that conservatives typically trust the market over government to do things. So another way to make sure everyone has insurance coverage is to offer some sort of government insurance, right? A single payer system, perhaps, a nationalized health system. But that would be trusting the government with this, which conservatives generally would prefer not to do, right? Conservatives would generally prefer to trust the market. So this idea of eliminating free riders and allowing the market to actually function was a conservative idea. Ultimately, though, this ended up framed not as a debate over this sort of conservative idea of an individual mandate and eliminating free riding, but rather as one of socialized medicine, where conservatives and more specifically Republicans were saying that this Democratic president and the Democrats in Congress were trying to push this socialized medicine plan. And socialism in the US, because history matters, tends to have very negative connotations dating back to the Cold War era. And since so many of our population were alive for the Cold War, socialism still sounds a little scary. So socialized medicine kind of made a lot of people think, ooh, I'm not so sure about this. Even though the system was not, in fact, socialized medicine, it is very much still market-based. But we see that logic of sort of not wanting your political opponent to get this big victory really shifted the debate. And why was it so easy for Republicans to shift the debate away from one that actually basically was a conservative one into something that sort of created this specter of socialized medicine? Well, because people don't like command approaches. We know that command approaches are one of the key tools for avoiding collective action problems, but no one likes them. No one likes being told what to do. I mean, duh, right? So, because people were unhappy being told what to do, it was very easy for Republicans to sort of turn people against the Affordable Care Act who might otherwise have been for it. So we can see how policymaking is this really dynamic process that involves input from a lot of actors and often is shaped by these media dialogues and these discourses going on between different political actors, private entities, like in this case, insurance companies, individual citizens, and the media. So we get this really complex interaction. If we think back to our discussion of the bureaucracy and issue networks, we can see how those more fluid dynamics come into play here. Now, ultimately, sorry, I realized I paused there like I was going to stop, and I was, but I should remind you, just in case, that ultimately the Affordable Care Act did get passed, sometimes known as Obamacare, and we did end up with an individual mandate and insurance marketplaces being established, and people with pre-existing conditions are offered coverage. The individual mandate has been upheld by the Supreme Court. There are some current legal challenges in the lower courts to the Affordable Care Act, but as of right now, precedent at least would tell us that the Supreme Court will continue to uphold major provisions of the Affordable Care Act.